Hello everyone. Today we are back with our main topic and that is breast cancer. Yesterday we talked about the development of breast during embryonic period and we talked about the anatomy of the breast. In embryology of the breast we talked about the milk line and all of those things, and in anatomy of breast we talked about lobules, terminal duct, selectiferous duct, and all of that. So if you haven't checked out that video, please go and check out that video first so that you can have a better understanding of the topic today. Because if you understand the anatomy of the breast clearly, then you can understand the classification of breast today. Okay, so let's begin, right? So what is breast cancer? Breast cancer is the most common carcinoma in females. And it's the most common carcinoma that is responsible for mortality in females. It's the second most common carcinoma that is responsible for the mortality in females. First, still being the lung cancer. Well, now you must have that question in your mind that breast tissue is also present in males. Then males can also have the breast cancer, right? Yes, breast cancer is seen in males as well, but it is very rare. So, breast cancer is seen rarely in males. It means if 99 females have the breast cancer, then only one male will have the breast cancer. So now let's talk about the risk factors. What are the risk factors that are responsible for breast cancer? First risk factor being the female gender. Females are more likely to develop the breast cancer. The second risk factor is the age. In increasing age of females, breast cancer is most common. It is usually seen in post-menopausal females. Now, let's talk about the multiparous females. If a female is giving birth to multiple children, then that female is at lower risk of developing breast cancer. And why is that? I'm going to explain it to you now. Because during those 9 months of pregnancy, a female is more exposed to the progesterone than estrogen. And estrogen is more responsible for the development of breast cancer. During those 9 months of pregnancy, a pregnant female is less exposed to estrogen and she is more exposed to progesterone. So that female is less likely to develop breast cancer. Whereas a female who is nulliparous, means if a female has not become pregnant in her whole life, then that female is at a higher risk of developing breast cancer. That's why you may have seen that in developed countries, females are at higher risk of developing breast cancer. Whereas in developing countries, the risk of developing breast cancer is comparatively low. Developed countries like in Europe, there you see the highest risk of breast cancer in females. But in developing countries, you are going to see less risk of breast cancer in females, because in developing countries, we all know that females, they have a lot of children, and in developed countries, the females, they just focus on their career more. And well, let's talk about the genetic factors. In genetic factors, we know two types of genes: BRCA1 gene and BRCA2 gene. If there is some type of mutation in these two type of genes, then a female is more likely to develop breast cancer. Menstrual history. If we talk about the menstrual history of a female, then if a female has history of early menarche or has a history of late menopause, then that female is more likely to develop breast cancer. And why is it so? Because in early menarche, a female is exposed to the estrogen earlier, whereas in late menopause, a female is exposed to the estrogen for a longer period. That is what we are going to learn in menstrual history: early menarche and late menopause. Here it was also exposure to estrogen. Breast density. If a female has more breast density, and that breast density is more in upper outer quadrant of the breast, then that female has highest risk of developing breast cancer, because there are a lot of adipose tissue, and that adipose tissue is converted into estrogen by the aromatase enzyme. Then more breast density, more risk of developing breast cancer, because adipose tissue converts androgen into the estrogen, and we know that estrogen is responsible for breast cancer. Radiation exposure. If we talk about the radiation exposure, if a female breast is exposed to the radiations like X-rays or atomic bomb radiations, then that female is also at a high risk of developing breast cancer. One of the most important risk factor that is more important in hereditary breast cancer, that is first degree relative. If a female's mother, first degree relative means include mother, daughter, or sister. If any one of these relatives, mother, daughter, or sister, has breast cancer, then the female is at higher risk of developing breast cancer. So this was all about the risk factors which you should know in breast cancer. Okay, moving forward towards the classification of breast cancer. Breast cancer it can be classified into non-invasive breast cancer or breast cancer in situ, one and the same thing. And the invasive breast cancer. The non-invasive is further classified into ductal and lobular. That is ductal carcinoma in situ, ductal carcinoma in situ, and lobular is lobular carcinoma in situ. And then there is invasive breast cancer. Invasive breast cancer is classified into, again, ductal and lobular. That is invasive ductal carcinoma and lobular is invasive lobular carcinoma. So what does it mean that non-invasive or in situ breast cancer and invasive breast cancer? Well, the difference is very clear. The difference is in ductal carcinoma, the tumor cells, they proliferate inside the ducts. They do not invade the basement membrane. Whereas in lobular carcinoma in situ, the tumor cells, they proliferate inside the lobules and they don't invade the basement membrane. Whereas if we talk about the invasive breast cancer and its subtype, invasive ductal carcinoma, the tumor cells proliferate and also invade the basement membrane. They are not just limited to the tumor cells, they are not just limited inside the ducts. Same goes here. Tumor cells proliferate and also invade the basement membrane. Means the tumor cells, they come out of the lobules and they invade the basement membrane and they infiltrate the stromal cells. As you can see in the picture, it is invasive ductal carcinoma. The ductal carcinoma, this is a normal duct, right? This is the normal duct, right? With the two epithelial linings. In ductal carcinoma in situ, the tumor cells, they are inside the duct. They are not invading the basement membrane. The basement membrane is intact. Whereas in invasive ductal carcinoma, the tumor cells, they are not just proliferating inside the duct, they are also invading the basement membrane. They are invading the basement membrane and they are coming out into the stromal cells. They are infiltrating the stromal cells. In lobular carcinoma, which includes the lobules, these are the normal lobules, right? These are the normal lobules with the normal cells, the two epithelial layers. Then lobular carcinoma in situ, here also the tumor cells, they are proliferating inside the lobules, they are not coming out of the lobules. But in invasive lobular carcinoma, the tumor cells, they are not just proliferating inside the lobules, but they are also coming out of the lobules and infiltrating the stromal cells, right? So this is the difference between non-invasive breast cancer and invasive breast cancer. Non-invasive breast cancer, tumor cells, they are proliferating inside the ducts or the lobules, whereas invasive breast cancer, the tumor cells, they are proliferating inside the ducts and the lobules, but they are also invading the basement membrane and infiltrating the stromal cells. That is why you're going to see a mass in invasive breast cancer, but you're not going to see any mass in non-invasive breast cancer. Now we are going to talk about each carcinoma in detail.